Thank
Okay,
you.
great. There we go. Um, Thank you for having me. As Sarah mentioned, I did this work a few years ago, so it's the summer of 2024. As it was a project with the Occupational Health Internship Program, which is a really amazing program. And if we have students here, which I think we do, you should look into it because I would highly, highly recommend. Um, yes, let me here just figure out my slides here. Okay, and as Sarah said, yes, I've been with MPHA for the last year and a half, and am going to grad school in the fall. So there'll be a new intern opportunity in December, January time, I believe. So keep an eye on that as well. Um, okay, let's see here. I think everyone can see this. Yes. Okay, great. Um, yes. Okay. Um, so my project was on occupational violence in grocery stores, which is something that was new to me. But it was something that was really the union that we worked with, 1189, UFCW 1189. This was a big issue that a lot of people were talking about, workers were talking about. So I'm really glad we got to do this project, and that the workers at least felt heard and actionable change TBD, but um, proud of the project. So this project was a part of OHIP, which I mentioned, which is a full-time paid summer internship designed to link the skills and interests of students with the needs of workers employed in underserved or high-hazard jobs. Students are paired with and work on projects for worker centers or unions, like I was with, across the country. We were um, in St. Paul, but there was students all over, um, and it was really a multi-state effort, multi-organization effort. It is organized by the AOEC, which is the Association of Occupational Environmental Clinics, with local organizations, occupational health centers to train the next generation of occupational health and worker advocates. So student eligible students like me have completed their junior or senior year of college or are in between their first and second year of their master's program, are eligible for the program. Many students apply, and then chosen students are interviewed and matched with training sites across the US. Students are mentored by worker center or union staff, depending on where they're located, and paired with, and OHIP advisors who help them complete the givebacks, prepare presentations, and write the report as part of the program. And then since the first group of interns was admitted to the program in the summer of 2004, there have been 433 OHIP interns who have been placed at 138 community-based organizations and unions to work at 226 occupational safety and health projects in 31 locations across the country and US territories. So a long-standing program, and really grateful to have been a part of it. This year, interestingly enough, there's another group from Minnesota who have been placed in Minnesota with the building trades, Minnesota Building Trades. And also will be advised by my advisor, Adam Moskowitz, as well. As a part of the program, we completed 3 days of training in Los Angeles, where we instructed on OSHA standards, various regulatory agencies that regulate worker safety, how to identify and control for workplace hazards, the intersections of worker health and safety, and the health equity issues that are related to that. We also had the opportunity to connect with occupational health professionals and OHIP alumni. We also took field trips to workplaces to tour the facilities and practice identifying the workplace hazards. I visited a commercial laundry facility, which I didn't really know existed, or there's a whole industry of it, which does laundry for workplaces like restaurants and healthcare facilities with you know, huge industrial washers and all the kind of like steaming and pressing that needs to be done with that. And we practiced identifying the workplace hazards that might exist in that kind of workplace. Okay, so on to my project. I was partnered with Victoria Valentina, who is actually now, I believe, Assistant Director of Occupational Health and Safety at UFCW. So very proud of her and her career trajectory after OHIP. But we were placed at UFCW, which stands for United Food and Commercial Workers, Local 1189, which serves parts of Minnesota, Western Wisconsin, North Dakota, including St. Paul and its surrounding suburbs. UFCW is an international labor union that consists of 1.3 million members in the United States and Canada and represents many industries, including food retail, food processing, meat packing, manufacturing, healthcare, pharmacy, bookselling, chemical work, and distilleries. Local 1189 specifically has approximately 10,000 members across retail, meatpacking, healthcare, bookselling, and the cannabis industry. Our project specifically was focused on the retail grocery Southern Division, which they also have a Northern Division, but we were located in more Southern Minnesota, so we were only able to get to the grocery stores that are around here. And that represents 43 grocery stores and almost 3,700 members in the area. Um, Interestingly enough, there's UFCW 1189, which is St. Paul and surrounding suburbs, and then there's another one from Minneapolis and surrounding suburbs. So depending on where you shop, you might be in two different locals. Examples of UFCW grocery stores are Kowalski's, Lunds and Byerly's, Cub, Oxendale's, and also Mississippi Market is a new workplace for them. So our project focused on occupational violence against grocery store workers. OSHA defines occupational violence as any act of physical violence, intimidation, harassment, or threatening behavior that occurs at work. These acts of violence or other injuries are the fourth leading cause of fatal occupational injuries in the United States, and affects employees, customers, and innocent bystanders. In 2004, fatalities due to violent acts was 733 in 2024, which is down slightly from 2023, but still in the 700s. Furthermore, the Bureau of Labor Statistics reports that almost a quarter of fatalities due to homicides occurred while a worker was tending a retail establishment or waiting on customers, and that was in 2022. Here, which might be a little bit small, but these are screenshots that were taken from news articles. In most of these occurred in 2024, where there were violent incidents in St. Paul grocery stores or right outside St. Paul grocery stores. And these are all happened at stores that were represented by UFCW Local 1189. In recent years, there have been a number of gun violence injuries and deaths in or just outside grocery stores. And also there was a string of bomb threats. In 2024, there are 4 stores represented by Local 1189 that received bomb threats to the store. So the objectives for our project was to learn more about the lives and daily workplace safety conditions of grocery store and food retail workers, to collect qualitative and quantitative data to gain a better understanding of worker safety and health concerns, and then to create give back products to support the locals' efforts to improve their members' safety and knowledge of their rights. So to achieve these objectives, we utilized a variety of data collection methods, including worksite visits and observations, semi-structured interviews, surveys, key informant interviews, and we looked at the OSHA 300 logs for some of the workplaces. And then over here is a picture on Victoria and I's first day of work, looking at the various hazards. This was, I believe, this was in the meatpacking area that could happen while at work. So during our internship, we visited 16 different work sites across the St. Paul area. Interviewed 54 workers. We received over 228 survey responses and conducted 5 key informant interviews. So now I will talk a little bit about results. Here are just some photos. This is Victoria and I touring the Kowalski Central facility, which is where they make a lot of the baked goods and do some of the meat processing that they do for the Kowalskis across the area. Um, and there's also Scotty again giving us a tour of the meat packing machinery at a local company. So the first thing I'm going to discuss is our semi-structured work site interviews. When we visited each workplace, we conducted brief semi-structured interviews with a list of general questions we wanted to ask each worker we talked to. We tried to interview a variety of workers in different roles, including pharmacy techs, stock staff, cashiers, deli and meat counter staff. These interviews lasted less than 10 minutes, and we asked about 5 questions per interview. They were on the clock, so which is you're allowed, the union staff and representatives are allowed to talk to people while they're on the clock. But we want to be respectful of their time and also not make enemies of the employers. Although through these semi-structured interviews, we collected information about their experiences, thoughts, and opinions about the safety of their store and the preparedness they felt for potentially dangerous situations. This table shows some of the results from our semi-structured worksite interviews, which we, after the fact, we coded by theme. So 64% of members interviewed had negative customer interactions, which included being yelled at or threatened. 26% of those interviewed mentioned a dangerous emergency occurring at the store, including, as I mentioned, a number of bomb threats, weapon sightings, or physical violence that they witnessed. Lastly, 38% of members interviewed had a negative perception of the dangerous emergency training they received or were counted not receiving any type of training. So for the next few slides, I'm going to talk about our survey. We uh, distributed a Google form and received 228 responses on this Google form. The survey questions were, there's a 226 questions on this survey. And we utilized Prompt, which is a texting tool that the union uses to contact workers to disseminate the survey link to everyone in the membership of the grocery stores that we were looking to learn about. We sent 3 texts through Prompt from July 12th to July 24th, 2024, before closing the survey on July 26th. And the survey was distributed to over 260 workers. We also posted posters with the QR codes in break rooms to make sure we could reach as many people as possible, and had a response rate of about 8.6% from the 2,645 members who received the survey, and about 6.2% of the UFCW Local 1189's membership that we were looking at. We had 3 objectives with the survey to kind of gain a snapshot of the demographics of workers who took the survey, including age, gender, and full and part-time status, store location, job title, and what time of day they usually worked. The second objective was to gain a deeper understanding of workers' experiences with occupational violence and potentially dangerous situations in the store. The third objective was to identify how knowledgeable union members were about their store's emergency plans and policies, as well as their rights in case they were a victim of a dangerous emergency. So here is the some demographic and role-specific results. Our survey results did have a slight overinflation of female respondents as the union as a whole, union members that we were looking at as a whole was, I believe, about 45% female. Notably, let's see, to pull my, oops, okay. Notably also the time at the store was not very the most The highest percentage was 1 year to 5 years. There's a lot of people, there's some people who we talked to who had been there for a very long time, but also others who were um, dejected in their experience. Another thing to note here is the hours worked per week. So because of the way full-time and part-time is differentiated, I believe even if people are working 37 hours a week, they're still considered part-time. And then also, if I remember correctly, not available or not don't have access to health insurance as they're not considered full-time. So that in itself is an issue and interesting to us as when we're thinking about how people manage whether they are in a dangerous situation, either physically or mentally. Okay. This first chart shows the types of verbal harassment respondents had experienced. A majority of employees have been yelled at, and almost a quarter have been threatened or experienced discriminatory or racist remarks. And notably, 16% have been targets of sexually suggestive remarks. 9%, can I go to the next one? 9% of respondents said they experienced verbal harassment at least once or twice a week, and 8% said they experienced it many times a week, and 3% said they experienced it every day. Next, this is a pie chart about experiences with physical violence. We found that 37 respondents, or 16% of all respondents, had experienced physical harassment while at work. This bar graph shows the dangerous or potentially dangerous situations that respondents had witnessed at their store. 156 people have seen shoplifting, 55 people have seen a weapon, and 27 people have witnessed an armed robbery. Shoplifting, when we were talking to employees and also in the survey, was a big concern for many workers. The employers request a response, so how they're supposed to respond if they see shoplifting, um, depended on what store they were at. It seemed to not follow um, a there wasn't a policy or a very clear policy on what they should do, depending on who owns the store, as opposed to the store, different store. One cub might say one thing, another cub says another thing. Um, There also were many workers who felt that they had a personal responsibility to stop shoplifting or felt personally responsible for the shoplifting and protecting the store from loss. This pie chart gives an idea of how aware employees are of their store's dangerous emergency policies and evacuation plans. Almost 50% of respondents only had a vague idea of their store's policies on dangerous emergencies, and 25% had no awareness of what to do in a dangerous emergency. And then here is respondents who have received training on dangerous emergencies. Those who received training, only 13% felt not at all prepared and ranked their preparedness a 1. 27% ranked their preparedness a 3, so in the middle on a scale of 1 to 5. And 19%, only 19% felt very prepared in the case of a dangerous emergency. Lastly, this bar graph represents respondents' awareness of whether they have certain rights or benefits related to a dangerous emergency as per their union contract. So 75% of respondents didn't know if they could pursue a leave of absence. And 79% didn't know if they could transfer stores, and about 50% didn't know if their store had a safety and security team, which they all should. So we found in this question some gaps in contract language, literacy, and awareness of what their rights are per the contract. We also conducted 5 key informant interviews, which consisted of about 11 questions and lasted between 45 to 90 minutes to get a little deeper into people's specific experiences that we couldn't do in the survey or in our brief semi-structured interviews. In addition to demographic and work responsibility questions, we asked key informants the type and frequency of safety and comforting culture training they received, how often they review this material with their employers, or how often they are required to review this material, and how well prepared they feel based on the training. Um, Specifically, we asked about de-escalation, active shooter preparedness, bomb threats, and other dangerous emergency training. Of the 5 interviews we conducted, 2 were pharmacy technicians, and that was, I guess, if can, imagine pharmacy technicians are under often a lot of stress, and people are sometimes a little belligerent when they either don't have the medication that they need ready when they need it. Um, all the other issues that come with getting healthcare and getting your meds. So both pharmacy staff who we interviewed reported verbal harassment on the job, um, which we also heard when we were conducting semi-structured interviews. Another key informant said that the abuse and threats were so bad at their last store that they transferred to a different store, and that in the transfer, they did not feel, or even the lead up to the transfer, they didn't feel supported by their management. And then another one of the key informants stated they felt like it was their fault, or stated specifically, I feel like it is my fault they were robbing the store in reference to shoplifting. They felt a responsibility to protect the store's merchandise, even though the store policy is like often to let shoplifters go. So here I will just go through some quotes of note. The first quote is in reference to dealing with difficult customers who may be aggressive or rude over things that the worker cannot control. They said, some days I can just shut it off. Some days it really bothers me because it's not my fault. I'm not the one to blame. Quote number 2 is in reference to whether they stop shoplifting. They said, my life is worth more than $100. Quotes 3 and 4 refer to how employees feel about the documentation or reporting system for dangerous incidents and near misses at their store. The majority of workers supported a reporting system that would better both hold the employer accountable for how they respond to dangerous incidents or harassment, and also help the rest of the employees understand the impact and prevalence of these kinds of things. So to sum it up, here are some of our major findings. Employees often deal with verbal harassment and occasional physical harassment from customers and coworkers, and some feel that their managers, store directors, or the company overall do not have their backs. Many employees do not believe video training is effective for dangerous emergencies, and some wish for in-person training. Knowledge of the new dangerous emergency contract language was limited, with high percentage of Kowalski's, Nolan's, and the Wedge survey respondents reporting no dangerous emergency training. Shoplifting and store security were an issue for many employees, and they often receive contradictory information or inconsistent information between stores on how to handle shoplifting. Most of our key informants support a record of dangerous emergencies or violent incidents, but some express concerns over how public the information would be and its potential effects on gossip morale and employee retention. So as a part of the OHIP project, we had to create 2 give back products, and after doing our interviews and our survey results, we decided to make Know Your Rights posters for one of our give back products. So here is what the the Know Your Rights poster looked like. We created these posters to educate workers on their rights and to empower them to take action against workplace hazard issues. They also aim to dismantle the hero complex by reminding employees that, to never physically stop a shoplifter, especially since they have no contractual obligation to do so. And we made 6 posters in total, 1 for each employer, that had a dangerous emergency section in their unit. For our second give back product, we drafted contract language for the next round of contract negotiations. This is, I think, our edited drafted language. Contract negotiations are currently underway. They were ratified at the beginning of spring 2024 and are just now ending and being negotiated. Um, so I'm not able to know currently whether this was included as is with edits, parts of it or all of it. Um, but fingers crossed that they were able to put some of this language in there. And here's just highlighting some of the main objectives of this language, which is to require the employer to keep a detailed record of incidents that occur in the store, note how management responded to the situations while protecting the identity of the victims, and also requiring employers to hold relevant in-person situation-based disaster, dangerous emergency training, which we found was lacking. Lastly, here are just some of our challenging successes. We ended up visiting a lot more sites than we had hoped and expected, and interviewed a lot more workers than we had even thought possible, which is largely in part to the support of UFCW and how much they were able to get us FaceTime with workers. Um, Also, their support in disseminating the survey, I think, was helpful to get a high percentage of respondents. Um, we also started early with our draft to make sure that we were able to write a comprehensive and detailed report, which was over 50 pages, maybe a little above and beyond, but that's okay. We also did experience a few challenges and limitations. We had to edit our survey a few times for clarification as we needed more specific on what we were requiring, especially for short answer questions. And then also we didn't receive the OSHA logs in a timely manner, um, which for some stores, which impacted our analysis. Just a few thank you and shout outs. Our supervisor at UFCW, Claire Vandenberg, Adam Moskowitz, who was our project mentor here in Minneapolis, Matt London, who was our program advisor at OHIP, and then the UFCW Local 1189 staff and the OHIP staff as well. Okay. Thank you for listening. Here's Victoria and I at Attica on our first day of work. Okay.
Amazing.
Okay, let me stop sharing. Okay.
This is a great presentation. I love the
Thank you.
posters.
Thank you. That
And
was I say Victoria took the lead on the posters.
yeah,
Yeah.
no, I loved the whole thing, but the posters were fun. My first job, I was a bagger,
Just to
at
stop
Oh,
you for a
uh-huh.
minute, do you want
yeah.
to stop the recording
Yeah,
now?
I'll do that. Stop.
Thanks.